Good evening, everyone. Welcome to my show. Autumn is here. I'm the host, Francine Crawford, and today we're going to welcome Whyvette Bonhom. She is a registered nurse. She has experience in working in the nursing industry for years. She's worked in hospitals, and she's also worked in nursing homes. So we're going to get a well-rounded picture of the nursing industry. Welcome to my show.
Thank you. Thank you for having me, Francine. I'm excited to be a part of this and excited to have the conversation.
Great. Well, first, just tell me a little bit about yourself and a little bit about your profession.
Okay. So I am currently a registered nurse. Actually, I am in grad school pursuing my master's in nursing. So I'm also a student. But my first encounter with healthcare, I was like 16 or 17 years old. I was a health occupation student in high school. So I've always enjoyed or just had this passion for people, taking care of people. I think it's just a part of me. When I went, being a part of that program in high school, we were introduced to a lot of different things. So I learned that the world of medicine was not just doctors and nurses. So I was introduced to this thing called recreational therapy, which I thought was amazing. I met this great recreational therapist at a nursing home. She was what you would call the activity director. And I was like, well, how do I get to do what you do? Because you're having fun. Like, this is wonderful. Like, it was music. It was art. It was like all these things. I was also a band geek. So it was all these things. And she got to take care of people. So for undergrad, initially, that was my major. I was a therapeutic recreation major. So I was a recreational therapist for about 10 years. And I went back to school for nursing because in my journey, I just worked alongside these amazing nurses. And I was like, you know what, this is really what I wanted to do. So I think I was just scared, or not scared. I don't regret any part of my journey because rec therapy gave me a wonderful foundation for just holistic care. And so as a recreational therapist, I worked in geriatrics, nursing homes, skilled nursing, assisted living, like Alzheimer's unit, dementia units. And then I also was able to kind of transition into behavioral health and mental health, which I have a true passion for. And then I went to nursing school. So as a nurse, in 2010, I became an LPN, a licensed practical nurse. I was working at a nursing facility, nursing rehabilitation. So it's acute care. So working with those individuals who have either had, maybe a stroke or a knee replacement or joint or back surgery or something like that. And their main focus is rehab with the intention of going home. I went back to school, got my RN. And a couple of years, a year or so after that, I transitioned out of the long-term care to acute care in the hospital setting. So.
Okay. So right now you're in a hospital setting.
Yes. And I actually, I currently work in the operating room. So. Oh,
wow. That's different too.
In 2017, I did a fellowship program. It's like a bridge program when you're already a nurse, but you want to kind of shift gears. So being in the operating room, it's not like when you work on the floor or when you work in med surg, when you can go from one floor to another, like to go into the operating room and understand sterile technique and understand the surgery and the procedures and things like that. It's a true specialty. So,
well, that my podcast is called Autumn is Here. So it's about senior care, or getting people to prepare ahead of time, giving them information that they can use to help their loved one, their parent. So it's not necessarily just directed towards the senior, but towards their children. If you're 40, 45, your parent is 60, 65, things that you should know, giving them what to expect, and things that, you just don't know until it happens. So we're trying to give information. So tell me a little bit about when you worked in a nursing home. In that position, because a nursing home, people are in a nursing home because they're not in a hospital. They don't need to be in a hospital setting, but they may need to be in a nursing home because they still need some medical care or some health care, and they need it probably more around the clock, maybe, or something like that, as opposed to being at home. That's my understanding.
Right.
Okay, so go ahead. You can explain better.
And it's definitely all about, the level of care that the individual needs. So, and I, a lot of times we say nursing home as like a general term, but even within the geriatric setting, there are different levels of care within that as well. So, when you think of a nursing home, there is that side of where I said subacute, which is like you don't need to be in a hospital, but you need 24-hour nursing care or a certain level of nursing care. But the rehab portion of it is your focus. And most of the time, the expectation is that you are able to do at least 3 hours of therapy a day. Now that might be speech therapy, it may be physical therapy, it may be occupational therapy, but the main focus is the rehab, and with the intention of you not staying there long term.
Okay.
And it's in that same building, that nursing home, most of them will have a separate unit where it's more long-term care. You can no longer safely be at home, whether it's, for different reasons, physically or mentally, you need 24-hour care, or the level of care that you need is more than what, having, an aide come into your home and things like that. You need a different level of care. And a lot of times, once someone is in the long-term care stage of their life, most of the time, those people are going to live there until they pass. Even while I was a nurse, something called the Eden Alternative. So it's initiatives. It's a whole program where the staff is trained and they're taught, how to interact with patients who have dementia, and how to make it an inviting place for them with their meals, with their, there's a certain level of dignity. We don't put, a bib on a patient and have them walk around in that all day. Right. If they're not eating, it's not mealtime, to preserve. And the last facility I worked at, family had to sign off and agree that they were okay with you even covering their clothes, putting a bib on because they're adults and they shouldn't wear, but a lot of the families, to preserve the clothes, they were okay with them, so, certain level of dignity and respect. And it's, just that's understanding. Important. Yeah, it is.
My mom was in a facility for years, and, I didn't know anything about it. I didn't know anything about nursing homes. I thought it was a good alternative if you could not take care of yourself or whatever. And it wasn't a totally bad experience. I know some people have bad experiences there. It wasn't a totally bad experience, but I learned a lot because she was there for a long time. And there were definitely a need for some things to be better. And my my thoughts on, nursing home. I as I watched them for years, and these are people, the nurses that were there, that were on my mom's floor and took care of her, were pretty good. But I also realized that there is no way that they could care for those residents fully and totally give them everything they need. There was just no way. It was, and I was there all the time, and you could see that it was just no way. There are some people where their relatives come up, but your relatives, even if your relatives come up all the time, they're not there all the time. They're working, and they come up for a couple of hours, or they come up in the evening, and then they have a time that you have to leave. So you're not there all the time. And I know that they had it's just tough to me. What I've seen is like it's tough to really cover everything and do everything that they need, and that's me. From a personal standpoint and what I see, I'm curious to a professional standpoint, because to me, it seems like it should be many improvements. And I don't know if there's a nursing home that has it all down packed, that they can take care of everybody or whatever. Maybe there is one out there. I do not know that. My experience is that it doesn't seem like it's possible, even for the people who really want to do it. It just doesn't seem like it's possible, whether it's administration that, and rules and stuff, or whether it's, that they just don't have enough staffing, whatever it is. So from a professional point, since you've worked in them, can you just share some information or enlightenment to this?
I mean, you're absolutely right. I mean, it's one of those things where you feel like you're just set up to fail. Like, no matter how much you, when it's your passion and you're doing it for all the right reasons, you went into nursing. Because trust me, I have in my journey, I have come across. I'm like, oh, what made you decide to go into nursing? For the money, and it's like. Not everybody is doing it because, I've always loved taking care of people, and that. No, not everybody is in it for that. Even the nursing assistants, it's like they just, I'm just here because until I can't wait till I finish nursing school. I'm like, well, and even once you become a nurse, you still have to do some of these things. Not everybody,
right. Exactly.
But absolutely, my experience as a nurse in the nursing home setting. For the most part, I worked in the evenings. So I got to meet a lot of those family members that came after work to check on their loved ones. So I formed a lot of connections with a lot of families. Still have some of those connections, Facebook friends and all of that. Mom has long passed away, but I'm still connected with the daughter and things like that. Because for me, it was a true, a passion. But it was a struggle every night. It was really hard. And, and it depends on who you're working with. It could be better, but it was still really, really difficult because on a given night, I was assigned to like 18 patients. How can one person... Right. I mean, and maybe on the day shift, there might be one additional nurse, but their patient loads, even during the day when patients are up, moving around, it's super busy. You have administrators, you have this, you have therapists. Can you give them this? I need to take them here. Dietary, maintenance, everybody. And the nurses still have to try to do what they need to do. And for me in the evening, I'm dealing with one patient, but I've got this family member who has a question, and mom has an appointment tomorrow. Is everything all set up? Oh, let me talk to social work. It was a lot. It was.
So let me ask you a question though. Is that something that's normal that you would have that many patients, or is that a range, like you have 14 to 18, or you have, it's not where you have 3?
Right. And no, not in that setting. And, if I could bring up a point, because I've kind of, and even now, because I'm in the operating room, it's still a little difficult to speak on because I'm not working on the floor anymore, but I still stay connected, and nursing leaderships and organizations have lobbied. They are fighting for there to be safer patient to nurse ratios. And a lot of places, legislation has been passed that that a nurse cannot take care of more than 6 people in a hospital setting. In a hospital setting. And even that's a lot. 6 patients. When I've had 6 patients when I was working the floor, that was a busy night. Even in the hospital. But those same regulations that I know of are not being pushed for in the nursing home and the long-term care setting. Why? I don't know. I think there is some things that need to happen. And there may be things that are happening that I'm not as, don't have the most recent information about. But I have worked in New Hampshire. I have worked in Maryland. I have worked in New Jersey in nursing homes. And I have not seen one where that is not, that's the norm. Like for one nurse to take care of, a lot of patients, a lot of residents. Wow. Anywhere from 15 to 18 residents. And let me just tell you, when I was in New Hampshire, the nurse who came on after I left, the 2 evening shift nurses, there was one nurse at night. She took care of now most of the time the patients are sleeping. There may be a few medications to pass and things like that. And you have your techs or your nursing assistants helping to, but if there's an emergency that happens with a patient and you're caught up and then something else is happening, one nurse, to me, it just felt like such a liability and whenever they would ask me, would you work night shift? I'm sorry, I can't. I just felt like my license would be in jeopardy because that's a lot of responsibility for one person to take care of 30 people.
Oh my gosh. Wow. And how does that work that they can do that? Is it because, it's private? Is it because no one checks? Is it because it's written down? Does the state have something where it says it's up to you to decide? Is that?
I think there are not as many regulations. All of those facilities, they have the state comes in and does surveys, and they have to be compliant with certain things. But resident to nurse ratios was not something that I ever heard spoke of, like in terms of we need to, hire another person because, these were units that were set way before I'd even started working in nursing. It was what I saw even as a activity director, as a recreational therapist working in long-term care, that the nurses took on large patient loads. Wow. And it's unfortunate because it's hard for you to fully give someone the care that you want, even when you're that nurse who does it for all the right reasons. You can't do it the way you want to. Right. You try your hardest, but it's impossible.
That's how I felt. That's how I felt watching. It was like, this is impossible. There were things that I tried to help with, but it just seemed like that to me. Now I'm outside looking in, but that's how it seemed. My mother was there for years, and I was there all the time. So I did see, that, and I saw nurses that were trying, but it just seemed like it was impossible. Wow, that's something that really needs to be looked at and really needs to be fixed. One of the things you had mentioned that you did work in the geriatric unit. I believe that was either in a nursing home or with physical therapy. Is there anything that you can say, like, what's different about working in the geriatric and the different things that you have to pay attention to or care for them?
I mean, definitely what I've told family members, friends, what I have learned, and it all depends on the person who's, receiving care. If they are, completely with it and can, let you know what's going on so that you can advocate for them as their loved one. But when you have someone who is, mentally, their memory, things are fading cognitively, then you definitely have to be vigilant, be present. Don't be routine. I was telling a family member recently, like, if you feel like your parents are at the place in their life where they need that level of care for their safety, then do what you have to do, but don't just be that one who dumps them and, like, now you're someone else's problem and I don't have to deal with, I'll just drop by, every week or so, and, mix it up, change it up, because I have definitely worked in unfortunately, some pretty bad places. I didn't stay long because it just made me cringe. But, you would have those texts like, oh, it's, 3:00, so-and-so's daughter will be here soon. Go get her cleaned up. And I mean, and
really,
some people might say, like, well, what's wrong with that? They want to clean her up before her family gets there. But when you know that they have let this resident or this person kind of just be all day, whether it's the incontinence or the messy clothes from breakfast, or, you haven't done their hygiene, you haven't taken care of their loved one the way you should have, and you're just, putting on this show because a relative is coming, it's not right. It's not fair. But when you're and sometimes the family members can't help. If I can only be there at 6:00 in the evening, I can only be there at 6:00 in the evening. Right. But if you have that day off, pop in at lunchtime, pop in, in the morning before work or something like that, so that they can't be so routine about the care that they, give your loved one, but that making sure that they are doing what they're supposed to do at all times. And I mean, sometimes that makes the difference. Or unfortunately, it may make the difference for your loved one. And it may not be just the standard for every patient, every resident. But as long as, you're doing what you can for your family member, it's important. And I think that's one of the differences in long-term care versus the hospital, because even in the hospital, you have to stay on top of things because you ask questions. When someone walks in the room, I'm sorry, who are you? What's your role in my mother's care? Because people just feel like I'm the doctor and I shouldn't have to explain myself to you, but you do. You're obligated to. And when you don't know that, you don't require that of them. And it's like, oh, she has this, and I'm going to do this, that, whatever. But explain it to me in terms that I understand. Make me understand. Answer, give me a few minutes of your time and answer my questions until I'm comfortable with the situation.
That's how it was. You depended on the doctor to tell you. And now, we have to have a voice and we have to say stuff, but we have to ask questions and not feel uncomfortable. And sometimes it is uncomfortable. I mean, you just have this, image that, they're going to take care of your relative. They're going to take care of you. They're going to tell you everything. But they're human. One, and sometimes they may be overwhelmed, they may be busy, they may slip their mind, things like that happen also because they're human. And sometimes they're overworked and things like that. So, we have to have a voice, and we have to say, ask the questions. But what happens if you're not getting the information or what you're asking for? Where do you go? Yes, I had to stop the tape right there. She will answer that question of who do we go to and what do we do when we have questions that we feel that they're not being answered. She will answer that, but she will also give us an overall about nursing in general. I want to know about the nurse that is not in a nursing home, but the nurse that may be in the hospital when your relative gets sick and they have to stay in the hospital for a few days. How much information is a nurse able to give you? And just to see if you have the same questions that I have, because I know sometimes I find that the nurse is in the middle, and I'm always curious about that. So stay tuned for next week when we do part 2 with Nurse Whyvette Bonhom, and she's going to give us some more insight on nurses. You've already seen that she's well-read and well-versed in being a nurse. She's studied, so we can't wait to see you next week. Thank you.